let's just jump right in. Let's jump right in here. How did you first get, I'm just always curious when I talk to a physician, how that physician got interested in that particular specialty. How did you decide? Because I know you're an ear, nose, throat doctor. Okay, right? So you're an ear, nose, throat doctor, just like Dr. Jonathan Aviv, but then Dr. Aviv got very interested in acid reflux and throat reflux, throat burn reflux, et cetera. How did you decide you wanted to get interested in sleep medicine, especially now it's popular, but back in the day, like nobody was even talking about this 20 years ago, were we?
No,
Right.
sleep is a very new field.
Okay.
In medical school, you barely, at least when I was in medical school, you barely learned much about sleep. So, but what happens is you do learn and you do know that people have sleep apnea,
Hmm.
but it wasn't really clear to me what's the best way to treat people. So I completed my residency at Mount Sinai. I went to practice, and before you know it, you realize that how many of your patients actually have a small upper airway and are at risk for sleep apnea. And all you do is just ask them a question, are you
Hmm.
snoring? And you find out that there's a very large percentage of people with this problem.
When you say small upper airway, do you notice that just by putting
Right.
putting a tongue depressor down, putting the tongue down and looking? Is that how you notice it?
So you start by just looking at the outside. So I look at people's faces and I look at the size of their facial bones, like
Mm-hmm.
the jaws, the upper and the lower
Hmm.
jaws. Is the face
The
narrow,
width of the
long?
jaw. Okay. The width of the jaw.
Exactly.
Okay.
The width of the jaws. Sometimes a receded chin, for example, also is a sign, or a small upper jaw in other ways.
Okay.
So there are things that you can see from the outside. And then, of course, you can have them open their mouth and look at, again, the size of the jaws. Are the teeth crowded because the jaws are too small? All kinds of little signs, even without a
Oh,
tongue
so
depressor.
crowded teeth is
Yeah.
an indicator. Okay.
It's a
Yeah.
risk factor. It just
Okay.
tells us that the jaws are small.
Okay.
Yeah.
And so you kind of thought this is untapped territory? Is that what you thought? Because it,
So what happened is I realized there's a lot of people with this problem, especially when you just ask them, do you snore? You realize they are having some narrowing, which is causing their
mhm.
snoring. And then I got very curious. I said, what do we do for these people? How do we help them? And having trained as a surgeon, I first went down the track of trying to figure out what do we do surgery-wise to help them? And I realized there wasn't
Mm.
a clear direction, that it was complicated.
Okay.
And that attracted me very much to keep going.
Because it was wide open and you
Exactly.
could actually make a market. I get it. There wasn't
Yeah.
much going on and you thought, okay, I'm going to go here, the path less traveled.